Hello, dear colleagues. A national organization that strives for social justice, respect for human rights, and social development through the promotion of social work, best practice models, and promotion of international cooperation. National Alliance has 6 directions. Members, professional social workers and specialists performing the function of social work in the system of social protection, healthcare, education and internal affairs. We have a lot of international partners like UNICEF, Caritas, and I want to share with good news. A few days ago, International Federation of Social Works accepted our enrollment application.
My name is Maria Prolutskaya and I'm a postdoc at the Solid Kazakhstan. My research and activity and practical activities are related to drug addiction rehabilitation. As a clinical doctor, I deal with medical problems of drug-addicted inpatient related to our clinics from all across Kazakhstan. And essential part of clinical work and rehabilitation services is related to multidisciplinary teams, where social workers play a key role performing threefold as trainer, case manager and counselor. During a 60-day rehabilitation period, our patients have 2 assessment sessions with social workers, series of group consultations and individual sessions and meetings. But besides case management and assessment, our social workers provide CBT, contingency management and community-based technologies. And I think that essential part of capacity building in social work is attributed to collaboration with NGOs and participation in international and local projects. And advocacy practice take place also in a social work routine. And as for collaboration and crosstalks between the Solid project, principles and outcomes and social work practice, I think that crosstalks and coordination with ideas is very essential. And our social workers became more aware about Solid online platform, where they can be aware about training materials and educational webinars. And in my day practice, I address social workers to have assistance and support in most challenging clinical cases. And in turn, I try to share my opinion, share my understanding and knowledge about new projects like the Solid project and new initiatives of the National Alliance of Professional Social Workers. And in conclusion, I suppose and I hope that these initiatives will be expanded to all clinics for drug-addicted patients in our Kazakhstan. Thank you so much. Bye-bye.
Hello dear colleagues, my name is Dalida and I'm a PhD student of Eurasian National University named after Gumilyov. I'm a participant of Solid International Project and my topic is Health and Social Support in the Republic of Kazakhstan Penitentiary System, the role of a social worker. This study aims to identify the main theoretical approaches to building the professional activity of a social worker in the penitentiary system, as well as to develop recommendations for protecting the health and well-being of women prisoners with HIV. The analysis of publications on this study problem has shown that social work in the penitentiary institutions are absent in domestic science. There are currently around 30,000 prisoners in Kazakhstan's prison.
The high prevalence of HIV infection among prisoners and pretrial detainees due to overcrowding and substandard living conditions make prisons and other detention centers a high-risk environment for HIV transmission. This ultimately contributes to the HIV epidemic in the communities to which prisoners return after release. Injecting drug use in prisons is of particular concern given the potential for transmission of HIV and other infection diseases.
Since there are fewer women in prison than men, the medical service provided to women are sometimes minimal or second-rate. With the advance of HIV infection, a new problem has emerged for women prisoners. Female prisoners need the same preventive measures and the same level of care, treatment, and support as male prisoners.
Hello dear colleagues, my name is Sanduash. At first I would like to say that I am very glad to be a part of this project. Now I am a member of an international project Solid Kazakhstan. And I also have practical experience of working as a social work specialist in a primary health care organization and also as a trainer and a supervisor. My practical work has shown the importance of social support of persons with addictive behavior, leading to an increase the number of social orphanhood, divorces, suicides and other socially significant problems. One of the solution methods is the application of case management technology. As a part of the Project Solid, I wish to research the theme, the use of case management technology accompanied of persons with addictive behavior, especially alcohol addiction. Purpose of my research is promotion of social work technology in Kazakhstan in the field of addictive behavior. The research will be conducted using triangulation methods such as focus group with specialists, in-depth interviews with persons with addictive behavior, case study, direct observation. I want to note that I had experience in managing as a case of people with addictive behavior where we were able to achieve resilience in a mother with 2 children who suffered from alcohol addiction. Also, as a part of the team of the National Alliance of Professional Social Workers, we conduct various trainings and supervision for social work specialists in various fields. Within the framework of this Solid project, I want to highlight several expected results for the promotion of social work in Kazakhstan. First, the development of an individual approach to working with people with addiction and their families will lead to improve health and well-being. Second is advocacy of the social work profession through the contribution to the introduction of the definition of social worker in the relevant legislation. Building a portrait of a social worker as well as defining a clear function of social work specialist.